Welcome, friends, to today's special episode of NTB Dialogues. Today, we are in conversation with Dr. RK Sood, the legendary District TB Officer as well as District Health Officer of Kangra, the most populous district of India's mountainous state of Himachal Pradesh. Be it a holiday or weekends, Dr. Sood and his team Kangra have been reaching out to the people and communities and trying to find out more TB, link all of them to treatment, and prevent all TB. The heavy rains of Himalayas, the thunderstorms, the powercuts, landslides, nothing has deterred them. Team Kangra has tried from early morning, wee hours till even midnight at times, doing record number of X-rays using ultraportable handheld machines, offering confirmatory tests to those with presumptive TB and linking to treatment those who are found with TB disease, and also offering TB preventive therapy to those eligible. Salutes to all of them and welcome Dr. Sood. It is an honor to have you with us today.
It's a real privilege to rather be on your esteemed forum, and I think it will be very learning and humbling experience interacting with everybody. So I think thank you for having me on CNS.
And can you please share some highlights of the fight to end TB on Ground Zero Kangra?
Sure. Is my screen visible?
Yes, sir.
Thank you. So I start with the slogan "Jan Jan ka rakhe dhyan TB Mukt Bharat Abhiyan," which means that Indian TB Free India campaign takes care of each and every one. And the real challenge is to engage everybody and this is the real beauty that everybody is engaged. I'm showing you a small picture where our community health officer has made this symbol of end TB, and these are like mangoes they placed on the mat. So just see the level of innovation our team is having, and we'll be discussing the team efforts, our advocacy communication, and it's a real this ending TB is really actually a teamwork. When everybody works together, we get results. So this is a glimpse from our team one, who's our national TB elimination program. We have a team of pharmacy officers. We have a team of our mid-level managers, our block medical officers. So it's a wonderful teamwork that's driving this whole uh, story forward. And here I like to share a very interesting this image. This is we did an advocacy workshop for all our administrative officers, and the deputy commissioner, who is the in charge of the district, he called upon all the officers to just get into the bandwagon and this thing strengthen this TB Mukt Bharat campaign. So shared a screenshot from my team members ex post, which is who's Subesh, and he's posted some glimpses from that event, and uh, news clipping, which is in Hindi, but I'll just transcribe for you that for ending HIV and TB, all should have a very positive, proactive role. So, just sharing glimpses on how our advocacy efforts and a multi sectoral response we are having. So, the Deputy Commissioner is chairing a monthly meeting for TB, exclusively for TB program. You can imagine he has around 150 committees to chair, and still he is giving his time and energy. So that shows the level of commitment in India. Another example from our multi-sectoral response. So, and the biggest game changer which you were referring to is the asymptomatic TB. So before 7 December, nobody talked about this. So since this 7th December landmark in India, we are screening everybody irrespective of symptoms for TB. If you don't have TB, we test you for TB infection and we provide you Cy-TB and we provide you TB preventive treatment. The 3 HP regimen freely available for everybody who's vulnerable. So it's a real game changer, and this was a very big challenge to communicate how we communicate this new message. So we developed this creative and we launched it this year. It's in Hindi. I'll again explain it, transcribe for you. That if you are vulnerable, you can have this TB without any symptoms. So vulnerable people should get their X-ray done, whether you have X-ray symptoms or not. And if you get this thing, if your X-ray is normal, get your Cy-TB done, and if your Cy-TB is positive, you will get TPT. And for more information on vulnerable populations, contact your nearest health wellness centers. So this is the key messaging that we are trying to give, that forget symptoms, no symptoms. Now the real thing is go for the chest x-ray, because convincing people to get your chest x-ray if you don't have symptoms is a real challenge. So this was one of the initiatives that we took, our team took, to really like make the things happen. We still are quite far away from this, but I'll just like to have a special mention of our star performer, who's Mr. Antriksh. Every day, early morning, he leaves along with the mobile X-ray. We have a made in India ProRad handheld X-ray, and he is able to achieve a output of around 300 X-rays every day, which is a really amazing given his this thing. So we really acknowledge this hero, and he is also a hero because he is not an NTP staff. He works for the National AIDS Control Program, and still he is giving his services voluntarily without any additional incentives. And speaking of other challenges, uh, we had a very heavy monsoon in India, and when monsoon happens, then trees fall down, then the electrical poles get uprooted, and the power lines get disrupted. So, sharing one example, there was a place called Durgela where there was an inverter in the school, and it was in the office of the principal. So the camp was shifted to the office of the principal. So that is the level of the community participation that we were able to tide over that power failure. Another incident is we had a remote area called Indora, and there we had a power failure, and the Gurdwara is the religious place of the Sikhs. So at the Gurdwara, there was an inverter, and with that inverter, we were able to have that shivir at the X-ray camp. So that is the real level of energy that has come into this whole campaign. So just sharing this some glimpses from Kangra.
Thank you. Okay. Dr. Sood, when we last spoke with you, this 100 days campaign for TB Free India had just begun. That is December last year. Now we have learned that this campaign was started in almost half districts of India, and now it has been extended to all districts nationwide. And it
Yes.
was able to find out 285,000 asymptomatic people with active TB disease. This is the figure we have with us. And none of these would have been found if X-rays were not used for screening all high-risk populations at their doorstep, irrespective of symptoms. Those were non-symptomatic people. So can you please share some highlights about the 100 days campaign How has it helped your district uh, in finding more TB, and how is it panning out now? What we see on social media, you and your team have been accelerating efforts on a daily basis in every blog to find more TB, link them to treatment. So, can
Yeah,
you please
Shobhaji,
share?
yeah.
Yes.
Shobhaji, thank you for this very good pointer.
Mm.
Uh, well, what from the experience of the 100-day campaign, we are understanding that Himachal is at a quite an advanced level of the NTB game. In states like Bihar, we are getting around 20% positivity among the screened. But here, uh, like we haven't got any additional yield in terms of TB patients. But our real yield will be the in terms of TB infection. And when we treat the TB infection, the whole epidemic will rapidly going to go down. So right now that site TB testing was bit disrupted due to some supply chain issues with the Indian procurement system, but now supplies have again started coming in, and the real game here in Himachal is every year we get 15,000 TB patients, we treat them. Next year we again get another 15,000. So that way the tap will never get closed. So we want to turn off the tap, and the way to turn off the tap is to find the TB infection. So first step is the AI based radiological information system, which immediately reads the X-ray, and all those who are chest X-ray clear, they'll go for site TB and TB preventive treatment. So that is our game plan. I think we are facing another very big challenge, that if I get an abnormal X-ray, now the next step is to get a NAT test done. But if I don't have symptoms, there is only one way to get a sample, that is bronchoalveolar lavage. So that's not easily available. So we need to keep the abnormal X-ray persons on clinical follow-up. So that is again a limitation in our present approach. I don't know how other people are doing with this X-ray based diagnosis, because we don't this radiological imaging we are using as a triaging tool, but don't use it as a diagnostic tool. So this is the right now the crux of where we have reached. And I'll really like to share that this power of AI is just a wonderful thing. Uh, Earlier we had our system which used to take 3 minutes to do one X-ray. Then we upgraded our laptop to 64 GB of RAM, and we got excellent results. The time which was taken was just reduced from 3 minutes to 1 minute. To just see the level of rapid change. So that was the real game changer in our this thing, that just by upgrading our technology, we were able to utilize the same equipment in a much more efficient way. And another thing which I would like to share is the level of community participation. Uh, Many of our camps are hosted by the people at their own residences, even in shops. So I'll just show you a glimpse where there's a shop where, and our team is actually conducting the X-ray campaign in the shop. So this is the level of participation from the community. People are supporting us in every way they can. So that's a real what you call Jan Bhagidari, what we call in Hindi, the community participation. When the program becomes community driven, then it becomes the people's program. So that we are moving towards that direction. So that is one of the beauty of this new campaign in India.
Thank you. So you agree that artificial intelligence is a very important part of the diagnostic process.
Definitely, because without AI,
Mm.
it would take many days to read all those X-rays,
Right.
and we would be having a backlog of X-ray reading. We have many machines without AI,
Mm.
so those people suffer from the same problem, that they have a backlog of reporting by the time reporting is done, then the person is no longer interested after 1 month to have his further test done, because after 1 month reporting is rather irrelevant. So immediate you get results and accurate results, and I think this is the beauty of the AI.
Right. So all handheld X-rays, they do not have the AI part in there. Is it true?
Yes. So right now, actually, the TB program did not procure handheld X-rays till now.
Mhm.
Uh, we procured one from CSR. Some NGOs have procured from their own sources on donors. ICMR has procured some handheld X-rays, but that is again without AI. So there are multiple models, multiple this thing ownerships, but we are trying to involve everybody who has a portable X-ray to come along with us and have some support for this campaign.
Okay. All right. Uh, you can you please tell us that what is inspiring for me is that the highly motivated people of Team Kangra. It really needs 100% commitment to work to save lives. How do you keep your team motivated to not just perform but do their very best and go out of their way? You have taken the example of Antariksh, and I'm sure there are must be others like him.
Many more. Yeah, we
Yes,
can't acknowledge everybody here. Some
yes,
of us, some of these team members have joined also today.
yeah.
And see, it's a innovation. Everybody is applying his own thought process. So I'll just share a example from today. I found this screenshot from social media. We have a camp on 21st, and our team is disseminating information through social media that come these are the services available. So this is the innovation of our team, and we really acknowledge this efforts by our team and various teams. Every block has a team. So just see this is an innovation by our smart city Dharamshala. They have LED displays throughout the city, more than 10, and we had a series of camps for a healthy Dharamshala Smart City. So on their LED display, they without any charge, they displayed the schedule of these camps and asked the people to come. And these are very eye-catching points, and everybody is able to get information. So this is like some innovations we had, and this we come to later, because you asked me like how they are doing it. So one of the strengths is youth engagement. There's the National Institute of Fashion Technology. We had a workshop with them, and we want to harness the energy of the youth, the creativity of the youth to achieving the sustainable development goals. So those people, they are elite people, but they heard for about TB for the first time. So there are many communities which are still left out of the TB dialogue, TB discourse. Similarly, you can see some youth from our Palampur. There's College of Community Science, and they've made a very nice message with colors to end stigma. And this is the real message that we want, that don't be afraid, don't be scared. So this is the youth who are the change makers. So I think we should salute the power of the youth who are the real change makers. And this is a glimpse from a marathon. We had a marathon on end TB and end AIDS, and this is a glimpse of those people who are running along with the dignitaries. So it's a real what you call Jan Bhagidari. And we have our mobile health teams, which is the Rashtriya Bal Swasthya Karyakram, RBSK. So they go to schools every day, Anganwadis every day. Our Anganwadis are the preschool nutrition facilities and non-formal education facilities. So they go to schools every day, and during those interactions, they make a point that they discuss TB also. So that's a real mainstreaming that has happened here. And uh, again, this is a very recent example. Two girls did a very nice duet messaging, and this things click on social media. Another ally which we have, we are very fortunate to have. is the media. Just like CNS, many other partners with us and who really support this campaign wholeheartedly. This is our Gunjan Radio community radio station. And this community radio station is always more than willing to provide us a platform for interaction, for dispelling the myths. And this is the All India Radio government radio station, and had a discussion on TB preventive treatment because this is the new thing. Lot of queries. Then there's a live program called Arogyam, which means being healthy, disease free. So this is a real sort of glimpses from stories with the media. And another thing, what we think is how our team works well is because we work with consultation. We ask everybody to share their plans and prioritize areas which they feel that they can perform best. So we develop the route plans with due consultation, and we have only one machine, so 24 working days, so 13 blocks, uh, camps per block. So people do give their best because they understand that they are getting this precious resource only for 2 days a month. So this is also one of the good thing. And data analysis, picking and you can I'll just this very valuable insights from this recent graph. See, we have some teams like Fatehpur, Gopalpur, Bhawarna, Nurpur, who are above the average. And you can see the gray bars are bigger than the orange and the blue bars because we had a upgradation of the technology. So that is why we were able to achieve more. So these teams, they are continuously increasing their benchmark. The campaign is picking the momentum, and though there is a variation across teams and there's a different level of motivation across teams, Shobhaji, I would like to tell you a very interesting thing that one of our BMOs really observed very interesting thing that the lady block medical officers are giving everybody a tough competition. So we have a lady block medical officer at Fatehpur, a lady block medical officer at Gopalpur. So they're really pushing everything to the limits. They come early in the morning, stay with the team till late night, take care of everybody in the team. So that is really what matters. I think it's a real teamwork that is happening on the ground. And this is a glimpse of supervision and monitoring. Physical meetings, our team goes to the blocks, and online virtual review meetings. We have calls almost every week. So we try to work together with our team and analyze the data. And one of the good things that we have started in the last 3 years is reward and recognition. Everybody who works hard deserves his due. So we try to acknowledge everybody on our social media handles, as well as we try to acknowledge them during our monthly meetings. So, and the media, we are really thankful for amplifying this effort. So this is the clip from the Tribune. The Tribune is the largest English daily in North India and a very impactful one. So, Tribune is giving a story that Kangra is making a rapid strides. It's a big boost in the arm for us. Similarly, these are the sorts of appreciations we give. And recently, four of our community health officers, they made very nice reels on Nikshay Mitra campaign, and we were very really impressed, and we tried to felicitate them. And this is an example of the administration felicitating our team on Independence Day, whenever there's big event like Independence Day or Republic Day. So the administration felicitates the best people. So they called for us that your TB program, share us the list of champions. So Gopalpur team is here, and Antriksh was not there, so I was there to receive Antriksh prize because Antriksh was there busy doing another shiver. So you can see his level of motivation. And this is the glimpse from a post by our community health officer. She's posted that we are very glad to be acknowledged for these reels. So this is the level of involvement we have, and celebrity endorsement is also coming in a big way with the program. Recently, we had an Nikshay Shivir at the police battalion, and the commandant of this battalion, he's a very famous singer. So we asked him that why don't you come and have your X-ray first, which will give a message, and he was more than glad to join us. So this is the sort of what you call support we are getting. This is the uh, superintendent of police who has joined us in this workshop for the youth. So again, really very uh, humbling for everybody. And just recently, our member of parliament joined us. Our MLA, the member of legislative assembly, joined us. Social media influencers joined us. There's a Niti Ayog, which is the think tank of the government of India, and a member of the Niti Ayog. He visited us, so he also endorsed this TB Mukt Bharat, and he gifted nutrition kit. So this is one of our influencers whom we have put on our posters and banners. So we are trying to engage everybody so that it becomes a collective team effort. And this is a very lovely picture by innovation by our community health officers. They are wearing this red arrow tattoo, and along with this insignia, they've made a wonderful creative. So this is something what is contributing to the whole campaign. It's not all red and rosy, but these are the good points that our teams are getting. And uh, despite all this, our teams are working day and night, and it's really a what you call burning midnight oil. And this is some of the results that we like to highlight, that how our teams are really working, and people are amazed. Even the ICMR people were asking me that our teams don't do more than 100 X-rays a day. How come your teams are doing such wonderful results?
Yeah, that is very true. And you have still not shared the secret of how you make them do the work, the main secret. Also, I'm very impressed by seeing on social media, there's so many female officers doing the work.
Yes,
All forced to women power. I am in for
yes.
that, and I'm sure they are a great example to be followed by others.
We have our senior treatment supervisor, Suchi from Palampur. And despite being female, she stays till late night, and she ensures that she drops all the ASHA volunteers home. So this is just an example. Many others are also doing similar things, but this is just an example of the shivers where I visited. I saw the level of enthusiasm among the staff. Like they didn't sound tired at 11 p.m. And I told that anybody who wants to go, please go. It's late. You need to take care of your families. But they said, no, no, we are going to close the camp and then we are going to go. So the level of this camp, so like this last camp where we had 605 X-rays, I called Antriksh and I said, it's quite late night and let's close the camp. He said, these ASHA workers and staff, they are not letting me go, that they are saying we want more. So that is the level of enthusiasm. And I also really don't know the secret. It will be a very good thing that how they are getting this level of enthusiasm. I think that's the wonder of the whole this thing system, that despite monsoons, we have very heavy monsoons. Sometimes half the day people can't be mobilized also because of the heavy rains. Sometimes we send the mobile team and there's a roadblock. It takes half an hour for the JCB to clear the roadblock, but still they're able to achieve heights. And I think anything more than 300 X-rays a day is very good, and more than 400 X-rays a day is outstanding because teams get tired. Many people have made their innovations. Some teams deploy staff in double shifts, morning shift, evening shifts, so that nobody gets tired. So it's like innovations from the field. Even we are learning these lessons from the people, and people innovate, they mobilize, and like we have a wonderful team who works on social media. There's one Yamini Sood who I will really like to mention. She takes care of our Instagram, and Instagram is the most popular, what you call, media, and first preference among the youth. So all the activities are acknowledged. What we want that everybody who does something, we acknowledge that from our district handle. So at least that is our like motto. So we want to build up the team, and we have lot of wonderful like collective efforts. That is what goes into the whole campaign.
Right. You're very right there. So, you have mentioned some challenges, but can you just elaborate on few of the ground level challenges you face in your work, which you have tried to overcome, which you overcome, but which could be a learning lesson for others also working in the field? What are the
See, just like we have 5 fingers, all fingers are not equal. So I showed you the graph of blockwise performance. So some people are not able to get the same results. So that may be different level of motivations among their teams. So we encourage everybody. We tell them don't be disheartened. You try your best, and whatever your best you can do is the best. So like some people do get disheartened that we tried our best, but we couldn't go beyond a certain limit. So another thing, the challenge is lack human resources, huge shortage, critical gaps of human resources. Despite that, people are plugging in, moving it somehow. Supply chain, we have lot of disruptions. SciTV, we faced lot of supply chain disruptions. So, uh, another challenge which we are facing is medical colleges. A medical college has so many doctors, and we are unable to convey the guidelines to each and every person. We have a mechanism of a core committee where all the heads of department and nodal people come, and we try to update them on the rapidly changing program. But lot of violation of the guidelines do happen, and just like yesterday my WHO consultant gave me a feedback that HIV positive people are not supposed to be tested with SciTB. It is treat only policy for household contacts and people living with HIV, but somebody had prescribed them SciTB. Either the patient had not disclosed his HIV status, or the doctor was not knowing that HIV positive people are not supposed to be offered side TB. It is treat only policy, screen and treat policy for these people in TB preventive treatment. So challenges are there almost every day, and that is why we have managers. That is why this that is the justification for our roles. Sometimes we'll have a supply chain crisis of net logistics. Sometimes the machine, the handheld X-ray machine will break down, so we need to coordinate with the technical support of our vendor. So it's like a daily challenge, and we need to check with our teams. But we really appreciate our team, and everybody is giving their best because everybody understands that this is a historic thing. We have reached the moon, but people are dying from a disease which is curable.
exactly right? You're so
So the whole game is saving lives. It's when everybody sees the big picture is saving lives. It's not the what we are doing is not just an X-ray or calling people or giving TPT. Through the whole process, all our team understands that what we want to do is saving lives. So that is the whole big mission that if we are able to save fellow Indians, that's a wonderful contribution which we can all make. We made polio history by working collectively. When I was working with WHO in the polio program, we never dreamt that India will be able to end polio because there were so many pockets of resistance, so many issues with sanitation. Still, India was able to end polio. So, similarly, we have this optimism, and just like in Nigeria, we have very good leadership, and the program is being monitored at the highest level. A weekly review by Government of India. Our governor, sir, reviews the campaign whenever he visits. So it's like very real time, what you call work, and very good team we have at the district level, at the block level, at the field level. Our community health officers who have recently like come in the last 3 years, they have been the biggest asset to decentralizing TB services. And they've done it very nicely, very intelligently, and very smartly. So I think I really salute our team. So that is the real, what you call, beauty of the whole campaign.
Thank you. Can I ask you a few personal questions, Dr. Sood?
Sure. That will be more than happy to
What
answer.
what brought you to the field of public health? Did you know back then that you would be spearheading India's one of the most important fights against tuberculosis and perhaps be closest to the NTB targets in India? And what personally motivates you every morning to rise and mobilize others to rise with compassion and dedication?
Well, I think it is my team members who motivate me.
Yes.
Everybody surprises me with new innovations. And I had an inclination for public health since the very beginning. In my medical college days, uh, I used to run off from surgery rounds and write papers with my mentor, Dr. Anmol, and I had 16 publications during my internship, and I was an outlier at that time. And then I came to know about the National Institute of Epidemiology, which is in Chennai. And I was fortunate enough to get my post graduation at NI Chennai. And the skills we learned there, they've been an asset. And our mentors, our teachers, they've been real, what you call, wonderful exposure, a global exposure for all of us, all the budding epidemiologists who went to Chennai and learned a lot of new skills, lot of new things. So I think public health is a very promising field, and I think I'll make a special mention of our guide, Dr. Vidya Ramachandran. She was a nurse by background, but she had done her PhD from USA. And this is an example that, uh, like, this is not a glass ceiling that if you've done nursing, you can't rise to a top position. You can still rise to a top position. So that's a real learning experiences. And COVID taught a lot of things to us, how we work together. And I think just like we've been able to win over polio, win over COVID, it is the same energy that drives us to uh, push the NTB drive here. So I think it's a real, what you call, cross learning from each other.
Thank you. And you never left Kangra. You stayed put in Kangra.
Yeah, that is the grace of God that God has given us the opportunity
Right.
to serve Kangra. And so I am a bit lucky also to be familiar with this geography, and so that makes it more easy for me.
Right. Dr. Sood, any life learnings you would like to share from your experience of so many years with others? You have spoken a lot about the youth energy, but the youth also need to learn and imbibe a lot from you. So, any sharings, any learnings you would like to share?
Well, we've been working with youth since the days of the National AIDS Control Program was in the inception. The Red Ribbon clubs were formed primarily to uh, address the emerging issue of HIV, and we did not tackle this youth with this just the simple information that these four ways you will not get HIV. We took the approach of empowering them through life skills so that they can have the critical thinking, the right decision making, responsible choices for a healthy life. And youth pose us very interesting questions, and we are able to try to give them some logical, scientific answers. And we see those youth, they have risen to very good positions now. So it's really humbling to see that this youth engagement is really very a very promising thing. Similarly, our community health officers, when they came in, they were like new to the whole system. They've learned it. They've learned the skills of social media. They're amplifying our TB Mukt Bharat campaign, and they're doing it with pride. That is the real, I think, thing which I am learning is people are taking pride in their work. If people are proud of their work, they enjoy it, they'll be happy, and if they are happy, then everybody will have wonderful output. So I think happiness among the team is one of the good things that we are having.
Thank you very much. Thank you very much, Dr. Sood. And we now open for reflections and questions from our audience. So, audience are welcome. We have with us Agnes Okose. Agnes, would you like to share your story briefly and your reflections, please? Yes, Agnes.
Okay, hi, how are you?
Good. Please, we are eager to listen to you.
Okay, I'm Agnes Okose from Kenya, Busia County, near the border of Uganda. Okay, I was affected with TB 2018, but due to misdiagnosed, my TB treatment took long. First, the last 2 years, it was a misdiagnosed. Then the time I was diagnosed with TB, I went through a lot of stigma. I started interrupting my treatment. I went to a relapse. Then after the relapse, I went back to the treatment. I was again, they added me instead of 6 months, I took my medicine for 9 months. Then after 9 months, TB reoccurred again. The TB reoccurred again through the X-ray service. I went through when after the X-ray, the TB reoccurred again. Then I took my medicine for 2 years. For 2 years, after 2 years, my daughter was diagnosed with the TB, chest TB through sputum. But she took her medicine for 6 months, and the TB was complete. She was completely healed. The challenge I went through when I was diagnosed with the TB, it was stigma from the society and the misdiagnosed. I don't know, from the facility, my parents took me to check on why I was suffering from the backache. They did not have those tools for diagnosis. So they referred me to other facilities for psychosocial support. So the challenges I faced because of misdiagnosed is I was tortured, I was disturbed, and I didn't believe that TB will be cured from me because I took my medicine for a long time, and I went on through stigma, discrimination, disclosure. I did not disclose about my status. But I thank God I was healed, and I'm now advocating to end TB at Busia County. And my daughter also was healed. So in Busia County, I have 40 TB champions from all the 8 sub-county advocating to end TB, creating awareness, earlier detection of TB, stigma reduction, and also engaging community on the outreaches. The time we have the outreach, we mobilize people to come and screen. We follow up them on their treatment journey and adherence on treatment so that they do not spread TB to other close contact. We also advocate for TPT, because the close contacts, when you are diagnosed with the TB, most of the community, they don't know about the TPT. So we are now advocating for TPT.
Okay, thank you. But you are here with us today, Agnes, and all force and power to the great work you are doing. You survived.
Thank you.
You survived to help others. That is it. Thank you. There is a question from Dr. Milton Chemhuru from Zimbabwe. Dr. Sood, he wants to know the proportion of those asymptomatic persons tested for TB who were found to have TB.
That is the real challenge we are having.
Yes.
Because asymptomatic, I am unable to test for TB because chest X-rays are normal. Algorithm says do NAT. But for doing NAT, I need a sample. I'm not going to waste $10 on testing saliva. So we keep them on clinical follow-up. So that is a real challenge on how we manage these abnormal X-rays people, because if you don't have cough, how do you get this thing? The same paradox happens with extrapulmonary TB. Extrapulmonary TB incurs the highest out-of-pocket expenditure for this diagnosis because people need to go in for expensive investigations, some MRI scans, CT scans, ultrasound. So that is a real challenge right now, that from this asymptomatic, the real yield that will come, that I get, is the yield of TB preventive treatment. Like 3 lakh people, I intend to do a X-ray. Out of that, 90% will be normal. Out of the site TB, around 20% will be TB infection. And if I am able to put even half of those TB infection on TPT, that will be the real win of this campaign.
TPT will be the real game changer. That is important, as you said. Unless you close the tap, you can
Yeah.
keep on mopping the floor, but the water will keep on flowing from there.
Yes, yes.
Coming,
And
yes.
yeah, and our state is at an advanced level in the TB epidemiology. Like India is not all one boat with different levels. Like states like Bihar, which are at a lower means which need to do more, and we have states like Gujarat, Sikkim, Kerala, Himachal, which are ahead. So our number needed to test is higher. So we, despite searching, we may not get more additional cases. So maybe that we have reached a plateau, or we are about to reach that plateau. So that is also one thing that, despite this active case finding, we didn't get additional load of patients. So many people are concerned that why, despite this additional case finding, you are not getting more patients. So maybe we've reached the plateau.
Right. True. Kavita Upadhyay wants to know if there is any difference between asymptomatic and symptomatic people screened by handheld AI-enabled X-rays in terms of those with presumptive TB.
Well, for the symptomatics, we are not actually using handheld X-rays. Anybody who has symptoms, we directly do the upfront NAT. So this handheld X-ray is for the people who don't have symptoms. So if you have symptoms, we will directly go for the upfront NAT. We have switched to upfront NAT this year only, and we are facing a lot of challenges in implementing upfront NAT because machines are limited, turnaround times have increased, but still our teams are working like really very, very hard to give results early. And bigger challenge is in the medical colleges where clinicians demand the report same day. So that is a real this thing. We are hoping for a patho-detect machine which is made in India, which is going to process more samples simultaneously. I think it will be like something like COVID testing. So maybe we'll be able to cope up with that challenge then.
Zafar Kidwai wants to know that has the shift to taking AI-enabled X-rays for TB screening, has it reduced diagnostic delays or catastrophic costs? What are the learnings? And also,
Definitely, I
yes,
think this is the area for research, and we haven't actually analyzed this thing, but it's a very good food for thought. Definitely, see, if I go to a hospital, stand in a queue, there's a loss of wages. I stand in a queue three times. First of all, I get a registration slip. Then I go to the doctor to get prescription. Then I again stand in the queue of the X-ray. Then I again go stand in the queue of getting the X-ray report, and then I again stand in the queue of showing it my report to the doctor. So we are skipping five queues, and the person gets this X-ray report within 1 minute. That is the amazing power of AI. I think wonderful technology, but it needs to be scaled up. We are advocating with the government of India that we need more machines and we need people to operate the machines. I have only one highly motivated Antriksh. If I get one more machine, who's going to operate that machine? So lot of challenges are also there, but lot of potential is there. And AI, we are using it wonderfully. Our team is using AI even for our social media content. You write anything in broken English and it makes a wonderful social media post.
right,
So I think that's the beauty of AI.
right. Zafar also wants to know if these X-rays, handheld X-rays, are they indigenous or are they foreign made parts which you all are using?
Fortunately, our handheld X-ray is indigenous. There's a mix of various,
Okay,
this, depending on the who's financing them.
all right.
Like in Mandi, Fujifilm gave one, so that may be foreign made. We have Indian made ones. So it's a mix right now, but Government of India is in the process of procuring more than 1,000 handheld X-rays. And maybe these will be the ones made in India. And we are like very satisfied with our vendor. Excellent technical support round the clock. When my computer gets any issue, like they immediately support us. The backend teams takes it online, and even if they need to come, they come overnight because my camps take a break only on Sundays. So I tell them that for any like issues, you need to sit with the machine on weekends only or late evenings, because my camps continue even in late evenings. So it's a real challenge to like even get the technical bugs removed.
Right. And also, Zafar wants to know how many get upfront molecular testing.
Well, it is 99% now.
Mhm.
The 1% is that some people in the medical college or the clinicians still insist that maybe this NAD report will come in after 2 days. So you give me the microscopy testing. But 99% of people here, we are able to provide upfront testing. In Himachal, the tribal districts had already started upfront molecular testing more than a year ago, but here we have a very high population and capacities are still limited. And I'd like to place on record our thanks for the administration. They gave us TrueNet machines from COVID funds. They are giving us TrueNet machines from various other development funds, which are the non-conventional ways to scale up our capacities. And even the member of parliament have their discretionary grants. So members of parliament are also come pitching in to support this TB Mukt Bharat campaign. So that is the beauty of this whole campaign, that we are trying to scale up, because if I speak of Kangra alone, I have 25 NAT machines. And I need at least 45 to be able to offer the a turnaround time of 2 hours, that within 2 hours you will get your report. Otherwise, getting a report after 1 week is like a tragedy. So that is what we are aiming at. That slowly and slowly we scale up, and our district magistrate is also very, very supportive, is providing us support. Our state leadership is also very supportive. National leadership is also supportive. So it's a very, very big team effort, and I think we'll be able to provide upfront net for everybody. And recently, Stop TB Partnership had a very innovative webinar on pooled sample, just like we had pooled sera for this COVID. Maybe we'll be able to cut down the cost of TB testing from $10. Maybe we may come down to $2. So that is a real promising change that I'm seeing in the near future.
Yes, that is true, doctor. But only thing is the changes which come should reach the people for whom they are intended as quickly as possible. Because sometimes there are a lot of troubles on the way, and by the time that technology is used, it takes. So let us hope for that. And with people like you at the helm of affairs, we can actually dream of a TB-free India and a TB-free world. Thank you very much, Dr. Sood, for giving your time today to us and for enlightening us with the wonderful work which is being done in Kangra. Thank you very much. Thank you.
Thank you, Shobha ji, and it's been a real pleasure. I think we look forward to interactions
Yes,
with NS team, and you've been very, very supportive, and it's a real like pleasure talking to you.
thank you. Thank you very much, sir. Thank you.